This Breast Cancer Awareness Month, we've been sharing resources about the importance of early detection, mammograms, and medical checkups. But we also want to share the stories of women who have been affected by this disease and are now survivors. Joining me today is Aliette Arner. Thank you so much for being willing to share your experience with us.
Thank you for having me here.
And congratulations for about a year of being a survivor.
Thank you very much. I feel amazing.
That's great news. So tell me a little bit about, take me back the couple years to 2020.
So I have been getting regular mammograms and breast MRIs since I was about 31 years old due to family history. No one in my family has tested positive for the BRCA gene, but my mom had breast cancer, my grandmother's sister, her two daughters have had. So it's always been kind of in the background. I had my last breast MRI was February 2019. So I was due February 2020, but like everybody in life, sometimes things get a little bit delayed or run a little bit later than usual, and March rolled around and we all know what happened. The pandemic hit. So it really went on the back burner. And when things started to normalize, stabilize a little bit in the summer, I am a teacher. I was doing my regular summer to-do list, and on there was go get a mammogram. So I signed up. It was June, maybe a few months late, let's say. And when I went in, right away they were able to spot that I had 2 little spots in my breast and apparently something in my lymph node. So they told me that there was something a bit suspicious, that I should come in the next day, which I did. This was all at the Women's Diagnostic Center. And the next day, I got a call from my fabulous OBGYN saying that it was cancer. I can't say I was totally surprised, because the moment they found something, after so many years of being checked out and there not being anything there, but it still is never the phone call you want to hear.
Of course not. And were you having any symptoms before this mammogram, or it was just, your normal yearly checkup?
Normal yearly check. I was literally checking things off the summer to-do list. We had a trip planned. We actually did still go on that trip on that Friday. So I got diagnosed on a Wednesday, and that Friday we took off on a family trip. And I said, this is not going to change anything. We're just going to push through and do what we have to do.
And that attitude, I'm sure it made all the difference.
Attitude is key. You have to stay positive. You have to stay motivated and determined, especially when you have kids at home. I had an 11 and a 13-year-old. So I wanted to show them that you have to be strong. And when life throws a little roadblock, you're going to push right on through.
That's great. Keep going.
Absolutely.
So that day that you got diagnosed, I know you told me, kind of expecting it. What was that process like from that day moving forward? Your treatment, what was your plan?
The first thing that I felt was, I needed to let everyone know. So my daughter, my husband, I called my husband, my mom, and typical Miami fashion, everyone started making phone calls to see who they can get you to see, who you should go see. And it really was smooth sailing. I don't know if it's little angels, but I always feel that God's plan is the perfect plan, and he got things going for me. And I had a doctor's appointment the following week to see a breast surgeon, an oncologist surgeon, and my oncologist. And I was very happy with both. So it was not really, fishing around to find somebody. I just dove straight on in.
That's great. And in terms of your treatment plan, I know that there's a ton of different routes that you can go with. What was the advice from the doctors for you?
The advice and my personal take was, I wanted the most aggressive thing possible. If it was up to me, I was like, cut them off. I didn't want the cancer anywhere near me, on me. But I learned, it was very different from when my mom was first diagnosed, 10, 15 years prior. And, her route was she did a lumpectomy, then she did chemo, then she did a mastectomy. Nowadays, the practice is you'd start with chemotherapy first to see how the body responds. And then you go in for the double mastectomy, which is what I did. Today we're blessed that there's been so many medical advancements and science is a marvel, that it's pretty much standard. Once they figure out what type of cancer you have, they know what chemo that they're going to use. They know how they're going to go about it. And my doctor was on board that I needed to do everything. So we did chemotherapy. We did the double mastectomy, bilateral. We did, more infusions, like immunotherapy, to continue making sure that my medications, were in for a solid year after. I did radiation as well, proton therapy. So I said, I'm not gonna die from this. This is not gonna be it. So do what you gotta do to take it out, and that's what we did. And I'm very happy that when I went in for my double mastectomy, my margins were completely clear. So I had killed cancer 100% by the time I went. Yeah, that was awesome.
That's great. And, of course, I know you mentioned the support that you had with your family and the treatment plan with your doctors. What else helped you get through this and keep that positive spirit that you had?
I would say my coworkers were amazing. I stayed teaching and working the whole time. I would even go in to get chemo and teach online because that's what we were doing in the middle of the pandemic. So I think the fact that I didn't give myself too much breathing room to say, woe is me, and oh, why is this happening to me? It was this push on through. I think that was key. I mean, I would even go to, the parks and ride roller coasters with my kids while I was getting chemo, wearing, my straight out of chemo t-shirt, letting them know that, you gotta just push on through and stay positive.
That's amazing. That's amazing. If any other woman right now is going through this, what would be your words of advice that you'd give them?
Well, early detection is key. So definitely everyone needs to go get their mammograms. But once you're in this boat, stay positive. Feel 100% confident in your doctors and your medical team and the staff that's working. They know what they're doing. This is a curable disease. Do what you have to do. Be healthy. Take care of yourself. Continue to work out, continue to walk, eat right, so that way your body is in the best fighting shape possible to knock this thing down.
And I know you mentioned that you do have a history of breast cancer in your family. Are there things that you learned that were new once you were diagnosed?
Well, what I learned new from when I was diagnosed was that really it can come from anywhere. There's no real factor. I mean, family history is not the only detection. So just because you think, oh, it's not gonna happen to me, you don't know. And it can happen at any age. I remember when I did the BRCA and they said, oh, great news. You don't have the gene. I go, well, how is that great news for my daughter when we have so much family history? At least if we knew the reason, we can kind of guide her. So with her, she's going to have to start getting mammograms even younger. They told me probably in her early 20s, she's going to have to start. So that was definitely something that I was not expecting to get.
Yeah. And now moving forward, you're done with all your treatments. It's been a year. Now what do you have to do? What's changed with your yearly routines, I guess you could say?
Well, I guess mammograms are out of the question now because they're gone. So that's a bonus if you're really looking for a bonus for this. And I always say that, right now I need to make changes in my life, in my health, in the way that I eat and the way that I do things, to make sure that, this body of mine is in tip-top shape. Because I promised my kids that there's one thing I'm not going to die of, it's cancer, and I'm going to stick to that. And I want to be the best for everyone in my home and my family.
And what about October, breast cancer awareness? Everyone wears the pink little ribbon. Right. Why do you think it's so important?
I just think it just keeps it in the forefront, and it's a reminder, like me, oh, I forgot. Just knowing that it's this month, I got to do it. It's a constant little reminder. So yeah, put it out there and just keep, raising funds for more research. You want to keep things as radical and up to date as possible.
And what about the support for all the women who have gone through this, are going through this, who may go through this? What can you tell them about finding those resources, finding that support group?
Well, it's amazing. It's a sisterhood. Like the moment you're diagnosed and someone's gonna find out that knows someone, and everyone in this community reaches out to one another to share everything that they know and to help you throughout that journey. And it kind of, for me, it's an honor to be on this side. I know maybe people think, it's part of a club maybe that you never want to be part of, but once you're in it, you're gonna thrive. And your sisters will help you thrive.
As you were going through this, I know you mentioned the support that you had of your family, your coworkers, your doctors. What were those fun moments that, helped you get through this and forget about what you were going through?
It's funny because people wouldn't associate cancer and fun, but it was. One of the most beautiful things that could have happened was during the pandemic, everybody knows, how would you celebrate a birthday? What would you do? There was always a little car parade coming down And I remember it was a Sunday and I was just sitting there. We were waiting to get things going. And my husband's like, well, you need to put on a dress and put on your makeup and get out there because we're gonna have a little drive-by for you. And I had like an hour and a half long drive-by of family, co-workers, students with their parents. It was old friends from elementary school. And I was wearing a big pink feather boa. They had balloons and signs. There was a beautiful surprise to get me going and motivated. And that outpouring of love was something that I will forever be grateful for. And I think that kind of set the tone for me. Not only that, but my family is very musical and very funny. And they wrote and made a video to the song Beat It by Michael Jackson, along with another Spanish song to, kind of pump me up for my double mastectomy. And then after my double mastectomy, I wrote to, the song from Hamilton, You'll Be Back. Well, I wrote about these, that they'll be back. And then I did a video, and I literally filmed the video the day before my double mastectomy. That's my double mastectomy was on a Tuesday, and I did it that Sunday, and I did a video, the last hurrah for my babies. So you do have to have a sense of humor and kind of stay focused and motivated, and happiness, attitude is key, and we can't say that enough. It really is the driving force. Envision in your head that you're killing that cancer like a little Pac-Man in your body. It's being eaten up. That you got to stay positive.
Well, thank you so much, Aliette, for sharing your story, and hopefully this can, bring hope and determination and happiness to anyone who's going through this right now.
Thank you for having me here. This is amazing. So much fun.
Awesome. Well, you can find more resources on toplinemd.com. And this month, we want to encourage you to take the time to speak to your Topline MD affiliated provider about breast screenings, any family history of breast cancer, and what your screening schedule should look like for the coming years.